He's an 86-year-old gentleman who was referred to me with a diagnosis of severe MR due to anterior prolapse, and that was the etiology. And I saw him in the office, and he's very short of breath. He's got a problem is he's diabetic. He's got a back problem. He's had a TIA. He's extremely frail, and he also has MR. And he, based on his just frailty, he's of course super high risk for surgery. His imaging was very challenging, and so what I did is I said I'll have to do this case anyway. It looked like to be moderate to severe MR by transthoracic, so I put him to sleep, and I'm doing his TE right now, and I'm actually going. I did a transeptal already, but I'm going to show you some of the images. Let's see the MR severity. Yeah. What's the blood pressure?
It's high right now. It's in the 180s.
Okay. And you can see a very prominent. So we did the transeptal puncture already. It was very difficult to do the puncture, so we had a difficulty. We put the guide in, and now we are just advancing the whole catheter into the left atrium. It's a very challenging image to see everything. And I'm pulling the guide back. We're too deep inside, so I'm pulling it right back as much as I can. He's showing me a nice short axis view. You can see the guide inside, and I love that. And I'm just going to do a little bit less to get it in, and I'm just going to advance the guide inside. Very narrow atrium, which makes it harder for us to come out, because if you see so it's sticking into the vein. So let's put the guide inside a little bit, and I'm going to go to RAO. So I think the guide is down towards the clip to the valve. So you can see it's a little posteriorly directed. I'm just going to make it anterior. And it's a little bit probably medial. You can advance your probe a tiny bit. If you advance your probe, you'll be able to see it. That's good. That's great. So I think you see how it's diving medially? I don't like that. So I'm going to pull back the whole system and take off a little M. And take a little bit M off. And I like that position. So now we are actually well oriented, and I really like the way he's doing the imaging. So I'm going to open the clip. It's completely open. As usual, it's rotated wrong. Someday we'll get it right. Okay, let's do 3D end phase. But you see, when you rotate so much, you lose. Okay, so I think I'm okay now. Put this in. I like that position. And I like the clip is oriented well with the commissure line. Okay, let's go in, yeah. And I'm just going to test the grippers. So that's posterior. You can, the dot is posterior, and the blue is anterior. Okay? See, now it's really nice, right? And let's put color there. I like that position. What do you think? We can go a tiny bit more medial. I think we should try to get as medial as possible. Do you decrease the tidal volume?
Okay.
So we'd like to decrease the tidal volume because that prevents the clip. See, that's a very nice picture. You see how he showed that it's in the middle of the pizza. And I think, Andy, I like that, right?
Yeah, looks good.
So I'm actually going to go in like this. So I'm going to close the clip, and I'm going to slowly advance the thing into the ventricle as he's keeping it. He's doing a great job in this imaging, which is actually extremely challenging. And now I'm going to open the clip, and you can see the microflail there, right? It really looks good. Yeah. So what we should do is bring it back and do a 3D. So I think you can see the anterior flail now beautifully. And you can see that the orientation is a little bit off. And I think I should counterclockwise it a little bit. You agree with it? Decrease the gain?
A little bit.
Yes, see that. And I think the orientation is very good, right?
Looks good.
All right, so I think the position is good, right? Question is, should we move it, bring it a little more
Color.
Going to color, yes. We can come back a little bit more medial if we want. Okay, so let's go to that BICOM LVOT view. He's on the money there, it seems like. You want to put color there? Yeah, I think it's in a nice position. So I would like to play with this color off. And I'm trying to be as medial as possible. And you can see how the anterior leaflet is falling nicely into it. Okay, and I'm going to drop each of the grippers. And actually, I want to make it a little negative. Yeah. 3D end face. Decrease the gain. It's difficult to see the clip, right? I can't see the orientation.
Gain a little bit.
Oh, you see? Oh, yeah, that's great. So you see it moved. So we should take it off, right?
You got a counter.
Yeah. A little bit of M. That's a bit too much, right? That's good, right? Like that. Now let's come back and explain. I'm just wondering whether we should have used an XT, yeah? I think we lost the orientation. Can we go back and see the orientation? Or for some reason,
I'm back on them.
3D end face that? It's in a good location. Okay, that's actually, the orientation is perfect, right? Okay, so let's keep the orientation correct and let's try to move more anterior. Let's go back to BICOM LVOT. That looks nice. And then I'm just going to open up the clip a little bit so the leaflets can fall. So the orientation is lovely, right? This is exactly where we want it, right? There's a jet again medial to that. So this is what we want to. Okay, so shall we just close it on this one and see what happens?
Sure.
Okay, so let's open the clip. I think we got posterior, okay? I think posterior is in. So the dot is posterior, so let's pull the blue
Correct.
back. Let's move it in. Okay, got that. Yep, now it's moving.
Mm-hmm.
I think we should check. I don't think we need to check. Lock it, good. I like this better. So we got a very nice anterior insertion. You also got a reasonable posterior insertion. Okay. And let's look at color now. Well, that looks really nice. First of all, let's focus on leaflet insertion. I think we have enough posterior and we definitely have enough anterior, correct? We also see that the jet has reduced a lot and there's only one jet on the lateral side. The LA pressure is 6 with a prominent A wave, no V wave. You can show him the V waves, okay? And we should look at 3D
Okay.
and see what it looks like. And we're on the very medial side of A2P2. And that's exactly where we want it. And you can see how beautiful that there's no color jet medial to the clip. Medial is on this side, right? And there's a lateral jet small far away, but there's a nice tissue bridge.
Yeah, it looks really good.
So you're, Colleen, that's the mitral valve, Colleen.
No gradient.
Colleen, you're an embarrassment for us. So now we could get, I think let's do one more color assessment and a leaflet insertion. And I would say we can do it at 0 degree if you want, or is he doing gradients? So we have this method. We do leaflet insertion first, then we see color flow, then we look at gradients, and then we do 3D and the pulmonary veins. So let's look at this one. He's showing it nicely. He's bringing the probe down. Advance your probe a tiny bit, and you see a very good anterior insertion of the leaflet.
You want to get color here?
And you can do color now. And there's no jet. And there used to be a big vertical jet going laterally, right? So we can do another view for the leaflet insertion, right? So I would just use BICOM, and because I think this view is not the best. Let's do a pulmonary vein, of course. I think you got the right upper, right? And the gradient. We may be done in this case. Yeah. So it's important to do every step. Yeah. So he's looking at the right pulmonary vein. It's all red, which is a good sign, right? Which means the flow is. So that's our normal systolic flow. Okay. So that's great. Was actually more, it wasn't very blunted before. Is that what you got before too?
Yeah, I was blunted
Okay.
before.
What's his blood pressure now?
158 over 78.
150?
158 over 78.
So that's very good. That's her blood pressure is 150, 170 with a LA pressure of 6. So that's a really good sign. And do you want to do BICOM LVOT? And let's look at leaflet insertion properly. Okay. I think that's the only thing we have to do. That's a nice BICOM.
Quick gradient.
I'm not actually but I prefer not to open it because everything else is looking good. Hope I didn't lose anterior. Posterior is definitely in. I like that. Okay. So Colleen, you want to do it? So first close it up tight. Okay, good. Now, I like to tighten it, clip nicer. The leaflets are in. Now try to open it. Good. Good.
There's neutral.
Good.
Positive side.
Yep.
Okay.
Then this one. Huh?
I mean,
Yes, we are. Okay, good. So now we're trying to grippers. Now floss it.
flossing.
Good. Okay. The key in this procedure is to have very good imaging. And I think we work with cardiac anesthesia, and they put the patients to sleep. They can control the tidal volume and get the circuit down. So try to open it, the clip. Now, actually, I like to,
Floppy, right? You'd like to
close it completely.
Okay.
And now make neutral. Just neutral.
Okay.
Good.
Okay. Neutral.
Good. Now take this
Then-
off. Yep. And then
Open
5 times.
until I see the.
So this is going to allow me to this. Yes.
Where is it?
Good. And
Do you
8
see it?
times.
Oh,
Yes.
there it
That's
is.
it. That's enough.
Okay.
1,
1,
2,
2, 3, 4,
5,
5,
6,
6,
7, 8, and then gently pull back. Pull that back. Good. And now the clip is deployed, very steady. And we see a beautiful deployment. There's no change in air pressure, which is good. And there's only just mild medial jet. So this looks very nice. And I'm actually now going to slowly take the M off. Just short access the guide. We always want to make sure the guide is in. Inside. You're ready to go. Open this up. Okay, that's good. Now you can interrogate the mitral valve. Okay, aspirate. So this was a nice placement of the medial part of A2P2. In a very challenging case, we use a smaller clip. But when we do this, before we take the guide out, we want to check everything. So let's do a study. First of all, what is the blood pressure?
146 over 76.
So the blood pressure is 146 by 70, which means that's good. That's what he is. And we're trying to assess the MR at this blood pressure. So he's first doing a nice 3D picture. And he's going to rotate it around. So we're doing a 3D end phase. We see the clip is very well inserted. Yeah. There was look at that beautiful picture, the aorta on the top, the appendage on the left side, and you can see a nice tissue bridge between the medial part of A2P2. And if you can decrease, yeah, and decrease the gain a little bit to make it more clear, the image. More atrium you should do. That's nice.
That looks really good.
Yeah, you should do more atrium so you get less ventricle. All right? And clockwise it to show me the medial orifice is very small. Yeah, so there's nothing. You see there's a tiny medial jet. There's a tiny lateral jet. It's actually gone. That's very nice. The gradient was only 2, right?
Yes.
And that's so now I think we got the pulmonary veins and I think we're done. While I start taking out the guide, you agree that we're not going to put another catheter inside, so I'm going to pull the guide out. Take the final LA pressure, please. It's key to assess the MR in normal blood pressure. So I'm going to order this. I'm going to, do we need to do another ACT? You did one moment ago? Okay, good. Measure this final LA pressure. This is with the guide out. And then we're pulling the pigtail out and we measure the LA pressure. Just want to close the groin. Yeah, his RA pressure is high actually. We probably should have done the right heart study to see what the pressures are in his lungs. He may be having underlying lung disease also. But at least we fixed his mitral valve very nicely. We've just a single perclose in the vein, and we'll do a figure of 8 stitch. We'll put a figure of 8 stitch in the groin now. Can we get a figure of 8 stitch?
Bad TR?
There's your right to left side.
Yeah, it's very small actually. Pedro, show the groin, and we're going to do a figure of 8.
Very posterior.
Did we see the final color? So I'm doing a figure of 8 stitch in the groin, in addition to 1 perclose. I find this very useful to actually stop hemostasis, and usually I keep it overnight, and then I take this figure of 8 out in the morning. And usually that's enough, because otherwise sometimes with just a single perclose, I don't like to use 2 percloses in the vein because sometimes it causes stenosis. I don't like that. So I usually put 1 perclose and a figure of 8 stitch. And this is a fisherman's knot that I'm just doing in the groin.
Not the best.
He's 86, very, very frail,
Maybe the best.
wheelchair bound, and this is such a safe procedure. His blood pressure didn't drop through the entire procedure. And now you can see that there's no bleeding in the groin at all. We put 1 stitch in the groin.
Yeah, I know. I'm just saying that's the view I'm going to get.
So I think that's nice. And put the color on there. You can see how medial we did a clip. and you can put the color jet there, and you can see there's absolutely no TR, MR. And that's actually just, that's artifact. There's really no MR at all. And you see how medial we were, which is where we saw the jet, correct? And and these are quite difficult sometimes to position the clip medially, and you see the lateral orifice is very big. So I actually want to, in the meantime, take the opportunity to thank everybody